Hello, everyone, and thank you very much for joining us on this short webinar where Dr. Ocker, our course tutor from Live Blood Online and Neogenesis Systems, will be answering your questions about live blood analysis, the training course, and the microscope systems. So thank you for your questions. We have some already that you've sent in. Thank you very much. If you have any further questions, please write them in the questions box in the panel on the screen, and I'll be keeping my eye on them, and I'll be posing your questions to Dr. Ocker. So let's get started. Hello, Dr. Ocker. Are you ready for some questions?
Yes, hi Elizabeth, thank you, and welcome everyone. So I'm definitely ready for any questions.
Marvelous. Right, well, first of all, do you provide microscopes for live blood analysis?
Yes, we do. We provide the microscopes that will basically allow you to see everything that is covered in the training course. Now, this is actually quite an important issue to touch upon, because it is a common pitfall. Many practitioners end up buying a microscope that's sold as a live blood analysis dark field microscope, and then once they start working with it, they find that it isn't actually up for the job, and there are many things that they're not able to see in the blood because the microscope doesn't actually have the required specifications to allow live blood analysis to be done properly in dark field. So unfortunately, there are many companies that are just misinformed about what is required in a microscope for it to be suitable for dark field microscopy. Perhaps their specifications that they're using are suitable for conventional and other type of applications in dark field microscopy, but when it comes to analyzing live blood samples, there are some very specific requirements that need to be met, and if not, if any one of them are not met, then one tends to struggle with identifying some of the important anomalies in live blood. So so we provide the microscopes. We actually have them manufactured according to our own specifications by a company in Japan that manufactures them for us, and we basically provide them to our students for their practices.
Thank you. That answers one of the questions that was coming up, which is, are your microscopes made in China? So obviously not.
Yeah,
Can
no,
I
they're not.
take the training course without a microscope? Sorry, go on.
No. I was just going to mention that we have tested several types of microscopes from various manufacturers. Over the years we have looked at them, and also with our attendees that join the course, they often ask us about specific brands and models of microscopes. So we're constantly looking at what's available out there and compare those systems to what we have available. And so far we haven't really found anything with exactly the same set of features. And we've tested various microscopes from China, and unfortunately, it's just the quality assurance that seems to be a problem. Something might be fine in one microscope, but in the next there's a major issue. So we exclusively source from our manufacturer in Japan.
Thank you. And can I take the training course without a microscope?
Well, yes, you can certainly enroll in the training course and cover the theory, all the theory aspects of live blood analysis without a microscope. For certification, though, you would require access to a microscope. We require a test case to be submitted. That's the final requirement for certification. So, for test case, the practitioner would have to have a microscope to be able to submit their case studies. But we do provide enough time for practitioners to submit their case studies after completion of the course, when they eventually get set up with a microscope.
Thank you. And do you have a payment plan?
Yes, we do have a payment plan for the course. We have a 50% payment plan where half is paid upfront on registration, and then the 50% or remaining 50% rather is then paid on week 6.
And can I miss a lesson? I won't be able to attend all of the lessons due to my time zone.
Yes, absolutely. So we've actually structured the course in such a way to suit any practitioner's need and every practitioner's schedule. So the live lessons are recorded. And they are available on the training site the following day. So practitioners who are unable to attend a lesson due to other commitments or time zone issues, the lessons are recorded and they're able to then access the recording the following day.
Thank you. Can I pay in US dollars? It's in British pounds on the website.
Yeah, the course is charged in British pounds, but you are able to pay in US dollars.
And what type of practitioner or therapist uses live blood analysis? And who is the training for? I think these two questions go together.
Yes, I think they do. Live blood analysis is used by nutritionists, naturopaths, functional medicine practitioners, homeopaths, health coaches, and anyone really in the field of natural health. Any practitioner working in this field who wants to gain information on their client's health at the cellular level will benefit from live blood analysis. And also any practitioner who has clients that are perhaps not responding to the recommendations or has found other tests and investigations to be unrevealing, and any practitioner who feels that actually seeing the underlying cellular disturbances in their clients' cases will help them make better treatment choices. So that's ideally who would use live blood analysis, and that's also typically who the training course is for. But also it's also for any person interested in the field of natural medicine who perhaps wants to start a new career path in the natural health industry. Because live blood analysis provides such foundational information on a client's state of health, it really is valuable to any modality in natural healing.
Okay, thank you. Well, that's the end of the questions for the moment. So anyone else has any questions, please type them in the box there and we'll look out for it. Okay, so you have a presentation for us, Dr. Ocker, yes, about the training course?
Yes, I do. I just have a few slides that we can look at. So, for practitioners who have not had any exposure to live blood analysis, perhaps have not seen it being done before, it might seem a difficult sort of idea to grasp, and what we would actually be looking for in the blood. So I just have a few examples of the type of images that we're able to get with a live blood sample and also a dry blood sample, and also just for clarification as well, the different types of views that we use. So this image that's on the screen at the moment is just a live blood sample in bright field. And there are various things that we look for here. We actually have some red blood cells. So those are the spheres or circles that are visible in the screen there. And then the grayish structure towards the upper right-hand side there is a white blood cell. So there are various indicators that we look for and deviations from normal that are interpreted as specific implications in the system. Right, a slightly larger view there of a white blood cell and some red blood cells, white blood cell right at the very center there. So this at this magnification, we can actually see the structure within the white blood cell here. We can see the nucleus as well as the cytoplasm and the granules in the cytoplasm. Dark field gets very interesting. We're able to see things between the cells in the plasma, and we're able to see a lot more detail in the cells as well. There are a wide number or large number of anomalies that are only visible in dark field because of the way that the illumination actually works. So we can see some examples there of what the white blood cells would look like in dark field, and very important to be able to get a proper level of magnification here. You can see the top left-hand side image there, slightly lower level of magnification than the rest of the images there. So the image right at the top left-hand side is actually the magnification that we use for identifying most of the live blood anomalies, and that's about 1,600 times with our specific microscopes. The more magnified images there are about 4,000 times taken with our 100 times objective. If there are any questions, please just let me know as we go through them. Otherwise, we'll keep going, and then we have a short case that we can talk about at the end as well, just to illustrate how things change in a live blood sample. All right, so these are actually dry blood samples that we're looking at. That's the other type of test. It's a different sample that's taken from the same pinprick of the finger, and the blood is allowed to dry there. And there's various anomalies that we can see there then that are not visible, or can't be seen in a live blood sample. So the two tests work very well together, very a good combination to actually do both. We get a very wide range of information. Now, there's of course a typical healthy dry blood sample, and then of course these are some of the abnormalities that we can see. All right, so I'll give you an idea of the type of images that we see in live and dry blood samples in bright field and dark field. This is just a short case just to illustrate the type of changes that take place in the samples before and after treatment. So this was a 46-year-old male that was suffering from hypertension. We have the images before treatment. So this was with the first appointment on the left-hand side there, and the images on the right-hand side would be after treatment. Now, I'm sure that most of the attendees are not familiar with what normal blood would look like, but it's quite obvious that the image is on the left-hand side. Well, they don't seem very normal. So the cells over here are stuck together. Just out of interest, we have a group of thrombocytes here. So that's platelets that are grouping together and actually forming a microclot in the blood while the blood is circulating. And then in the image lower left-hand side here, these lines here are fibrin, and they work together with thrombocyte aggregation to actually form clots during the coagulation process of the blood. So these indicators that we saw here with this gentleman actually indicated a very high risk of cardiovascular health, potential issues with thrombosis and embolism as a result of the overactivity of the platelets here. And it was a very interesting case because this client was advised by his doctor who diagnosed him with high blood pressure, that he needed to change his diet and lifestyle, but he was also put on medication. And he didn't really feel that there was a need to address his diet and lifestyle, because he was on medication from his doctor. But seeing the way that his blood cells looked and all the indicators and potential risk factors that were identified with this test, it actually gave him a bit of a wake-up call. It gave him a bit of a fright, and he actually became motivated to change his lifestyle and start making changes. So we saw that all the indicators for thrombosis actually cleared up completely in his sample because he started making positive changes to his diet and lifestyle. And essentially, if this was left unchecked, it could have resulted in some serious cardiovascular incident. But fortunately, because he had the opportunities to see what his live sample looked like, he was able to make a change at an early enough stage. All right, so I think that actually brings us to the end. Are there any additional questions at all, Elizabeth? Hello, Elizabeth.
Sorry, I was muted.
Oh, there
No,
we
there
go.
don't seem to be any further questions. But would you like to just tell the attendees how most of the anomalies that we see, the treatments are actually provided in the training course?
Oh, brilliant. Yeah, that's a fairly common question that we get as well, very important. So we do cover interventions in the training course as well. Under each anomaly, we have a list of specific recommended protocols that includes specific herbal products and other natural nutraceutical products, as well as suggested changes in the diet and lifestyle. And that's quite an important point to stress as well. You know, the test is not just used to try and sell people some supplements. That's not the value of the test at all. What we're able to do, and you know, like we saw in this case example that we looked at, is that we're actually able to motivate people to make changes in their diet and lifestyle that will benefit them in the long run. So very, very useful in you know, in cases of prevention as well. So definitely interventions or treatments that are recommended for what's seen in the blood is definitely provided in the course.
Thank you. And the live blood analysis is also very useful for gauging the efficacy of any treatment, isn't it? With looking at the blood on subsequent visits.
Yes, absolutely. So it's extremely useful for that. You know, you know, a great benefit is this visual impact. You know, people often get a bit of a fright when they see the condition of their blood, and they become motivated to do what needs to be done in terms of diet and lifestyle to improve that. But for the practitioner, it's also extremely helpful in that it helps to they're able to monitor and track the effects of treatment. So during a you know, treatment of, you know, even a chronic case, it's especially useful in chronic cases where one is not always sure of what's going on in the system, and if perhaps something was overlooked, or if something is perhaps not working the way that it's expected to work. With live blood analysis, we're able to track those changes during treatment in real time and implement changes you know, to the treatment program at a much earlier stage, so we're actually able to get faster results. You know, you become more effective as a practitioner, and also being able to see changes taking place during the course of treatment, even while they're perhaps not feeling a great improvement yet, is of course also extremely motivating to the patients or to the clients, and prevents this issue that many natural health practitioners struggle with you know, clients coming to see them only once, and then you know, they then go and see someone else, and you know, hoping to get some sort of a result within the first few weeks of treatment, which often is not possible in chronic cases anyway. So very useful for practitioners in that it helps to keep your clients compliant, and keep them actually motivated during the treatment program, so that we can actually get to a point where we have long-term results.
Yes, practitioners say that it has a huge visual impact on clients, which of course it does.
Yes, absolutely, and it's also one of the reasons, well, that I've seen in my own practice with you know, people actually coming back. So before I started using live blood analysis, I didn't have as high a rate of, you know, return of patients to my practice. So with live blood analysis, I noticed that often people would phone that had seen me before, and would phone not to consult with me personally, but to actually just see what their blood looks like. So they noticed before, or they saw for themselves before, how what they saw in the blood related to how they felt, and how addressing what was seen in the blood helped to make them feel better. So you know, as soon as something changes with their health, the first thing that they want to know and want to see is what their blood actually looks like. So really helpful in a practice in actually retaining your patients as well.
Did you say that there was an experiment done where in a consultation, the clients were given photographs of their blood? Can you tell me a little bit more about that?
Yeah, it was actually a related study just to test patient compliance and how long they managed to stay compliant for. But they actually used pictures of from an angiogram. So these people were given an angiogram and then separated into two groups. The one group was just shown the pictures of their damaged blood vessels, and the second group were given the pictures and they were able to sort of refer back to them during this program. And in the interventions in the program, they basically just looked at some dietary changes that needed to be implemented, and they then tested the compliance after a period of time. And they found a very significant difference between the two groups, and the participants who were able to refer back to the images of their damaged blood vessels were a lot more compliant than those who only saw them once. So it illustrates the power of this visual impact in keeping people motivated.
Absolutely. Okay, so thank you very much for that. Oh, we don't seem to have any further questions, but if you do have any questions, please email us at info@livebloodonline.com. And if you want to know a little bit more about live blood analysis and the training course and the microscopes available, go to www.livebloodonline.com, and you'll also see our social media pages there as well. So thank you very much for joining us on this short webinar. And we have a training course starting next week on Tuesday, the 6th of April. You'll find information and an enrollment form on the website. And also email us if you'd like to know more about the two-part payment plan. So anything to add to that, Dr. Ocker?
I think just as from my own experience with working with live blood analysis, it was the most valuable tool that I ever added to my practice, and I used various other forms of testing, from looking at the iris to biofeedback type of tests and various types of conventional blood tests and investigations. The greatest a tool that I ever added to my practice was live blood analysis. And looking back, it actually feels like I was working in the dark before using live blood analysis, because when a client comes in, you're not really always able to work out exactly where the problems are arising from. With live blood analysis, it really just simplifies the entire process. Within a few minutes, you're able to see exactly where the focal areas need to be in a case. It would be almost like a dentist trying to work without having an X-ray machine. It's possible, but I'd rather consult with someone that has all the all the necessary tools.
Absolutely, yes, I do like that quote. So again, thank you very much for joining us, and we look forward to you joining us on one of our training courses in 2021 or maybe in the future. So meanwhile, stay safe. Thank you very much from me, and thank you, Dr. Ocker.
Thank you very much. Bye-bye.
Thank you. Bye-bye.